Namaste, I am Dr. Srinivas Tati, consultant orthopedic surgeon with special interest in joint replacement surgeries and sports injuries. I work at Medix Healthcare, Nanakramguda and AAG Hospitals, Gachibowli, Hyderabad. At the outset, I thank Qural for giving me this opportunity to give a public awareness talk about orthopedic surgeries and common orthopedic problems.
Feeling sick? Need to see a doctor fast? Book a video consultation appointment with top doctors and specialists using Qural Healthcare app. Enjoy a safe and secure conversation from the comfort of your home. Download the Qural app now. Qural Healthcare, done smart.
Orthopedic surgery is a surgical specialty which deals with bones and joints and its supporting structures including muscles, ligaments, tendons and the nerves. They give form and function to the body and are useful in performing movements and also protect the deeper soft tissues. The most common orthopedic problems can be broadly divided into the degenerative conditions secondary to wear and tear like osteoarthritis, inflammatory conditions secondary to autoimmune disorders or deposition of chemicals within the joint like gout or pseudo-gout, infective arthritis, trauma secondary to falls or road traffic accidents and also sports injuries. Bone tumors are less common but they can cause significant impact on the person's life. Congenital conditions and neuromuscular conditions are also dealt by orthopedic surgeons. The most common problem is the degenerative arthritis, particularly the knee joint. In India, almost 30% of the population is affected by arthritis. 45% of the women over 65 years of age have symptomatic osteoarthritis and 70% of the population above 65 years of age can have radiological changes in the knee joint. The arthritis in the knee usually presents with pain, initially activity related and gradually it worsens to be present at rest and also affect the sleep. The pain also can limit the patient's walking distance, day-to-day activities like climbing stairs or sitting on the floor. The knee can also swell up. The swelling can be secondary to inflammation in the lining of the joint or due to fluid formation. Patients may also develop deformities of the joint which can be flexible or fixed. Once it gets fixed, certainly the movement of the joint can also get restricted, resulting in stiffness. Some patients can feel clicks within the knee when they're moving the joint, and some of them can have instability, which is quite rare in degenerative arthritis. When it comes to the treatment of arthritis of the knee, we can broadly divide them into non-operative measures and operative measures. The non-operative measures like modifying the activities the patient can perform, such as instead of sitting on the floor, if you avoid sitting on the floor, the symptoms can be less. The other activities like avoiding twisting movement within the joint can also help in reducing the pain.
Use Qural app to order medicines from your local pharmacy. Enjoy speedy home delivery and up to 20% discount. Download now. Qural Healthcare, done smart.
Weight is a significant factor in worsening the symptoms in arthritis. So without saying, it goes to be very important in reducing the weight, which can significantly help the pain and also the progression of arthritis. In a normal walk, the weight going through the knee joint can go up to 5 times the body weight, which certainly signifies the importance of losing weight. Not only that, the muscle balance around the joint is also very important. The muscles in the front of the thigh called quadriceps and vastus medialis obliquus can be weak, which can also impact on the force going through the knee joint. The muscles at the back of the thigh called hamstrings, the calf muscles can get tighter, which causes increased force within the joint. It is very important to correct this imbalance and tightness of the muscles to improve the flexibility of the joint. Any joint is like a bearing. If you think about the bearing, once you tighten the bearing, the forces going through will be very high. When these forces are high, certainly it causes early wear and tear. That's where flexibility is very important in prevention of severity of the arthritis, and also it helps in maintaining the function of the joint. So non-operative measures like activity modification, reduction in the weight, physical therapy to improve the strength of the muscles around the joint and also to improve the flexibility of the joint have significant role early on in the arthritis. When you go to the doctor, the orthopedic surgeon will take a proper history to understand how the arthritis is affecting a patient condition and the quality of life. And on examination and looking at the x-rays, we can say the severity of the arthritis. On the x-ray, we grade them into 4 stages. The first and second stage, majority of the time, can be treated non-operatively. But when the patient enters into third and fourth stage, the treatment modalities will become a little bit limited. When the non-operative modalities fail, then patient can start taking simple analgesics, that is painkillers, which does not affect the kidneys or the heart. If the analgesics are also not helping, then they can consider intraarticular injections like a corticosteroid, which is safe. It does not have any systemic effects. Hyaluronic acid has been used quite extensively. However, a lot of research studies have shown not much benefit with hyaluronic acid, and it is gradually fading away in usage. The new modalities of treatment like platelet-rich plasma and stem cell therapy can also be done, however, with very limited benefit. Patient selection is very important when we are giving option of treatment in the form of PRP or stem cell therapy. In my practice, I have very strict criteria when I offer the patient these 2 treatments. At the moment, I would say they are still experimental. There are no studies which have shown a significant long-term benefit. There is a lot of research out on these treatments. However, when you carefully look at the controlled trials, there is not much difference in the outcome. In focal defects which are unusual in degenerative arthritis, we can still give a trial with regenerative procedures involving stem cells. When the patient goes into stage 3 and stage 4, the most beneficial treatment is going to be joint replacement surgery, where we remove the damaged joint surface and replace with an artificial joint. Once the patient decides on what is the right timing to proceed with surgery, majority of the time there is a kind of confusion whether to proceed with the surgery or to continue with non-operative measures. Majority of the times the patients ask us, at my age, can I have a knee replacement? Let me tell you, age is a relative criteria. It is not a contraindication. In the recent past, we have seen younger patients coming with arthritis of the knee, which is significantly impacting their day-to-day activities as well as the quality of life. There are patients younger than 50 who are coming up with severe arthritis. When we look at the joint replacement registries from the Western countries, the average age group where we do joint replacement surgeries is between 65 to 75 years. However, there is a rise in the incidence of knee replacement surgeries performed in patients between 55 to 65 years of age. To add to that, there are significant developments in revision knee replacement surgery, and with the best available implants and the techniques, the revision surgeries are also giving good outcome. So if a patient has a knee replacement done around 55 years, their chance of that surviving is around 95% at 15 years and 80% at 25 years. If that patient's knee fails at 15 years, for example, they still can have a revision knee replacement surgery with decent outcome. So once we have decided about proceeding with surgery, the next question is whether to have a half knee replacement or a full knee replacement. Let me tell you, when you're offered a half knee replacement, we have to follow certain strict criteria for that to succeed. Among the strict criteria, one, the patient does not have a fixed deformity like in bend in flexion or a varus deformity like as in bow legs, which is more than 5 degrees. And the deformity should not be fixed, it should be correctable. And the other important criteria is the anterior cruciate ligament, which is a very important ligament in the knee joint, should be functional and intact. Along with that, the rest of the compartments should be normal. When these criteria are met, when we perform a half knee replacement, the patient's outcome is as good as a total knee replacement, and they also last more than 15 years. At the same time, when you compare the patient's physical activities, those who are having half knee replacement can have better function compared to those who have total knee replacement when the patient is properly chosen. The percentage of patients falling into those who can have a partial knee replacement are gradually increasing, possibly due to the early age of presentation. When we decide on total knee replacement, where we are going to change both the compartments in the knee joint, the other question which we come across is, can I have both the knees done at a time or one after the other? In my practice, the 2 knees done at a time is less than 5% due to the strict criteria I follow. There are proponents and opponents for doing single stage bilateral knee replacement and a sequential bilateral knee replacement. When you look at the complication, the risks involved in single stage bilateral knee replacements are significantly higher, and hence I will be very choosy when I am offering a single stage bilateral knee replacement for a patient. I do follow a strict criteria where the patient should have no significant comorbidities and not severe arthritic changes in the joint. Once we decided to go ahead with the knee replacement either as a unilateral or bilateral, the next question comes is what kind of implant I can use. There are several different designs from different companies. However, the underlying principle is the same. So the implant design is important. The material with which the implant is made is important. I would suggest to go through the literature, particularly joint registries, to see which design implant or the company made implant is working well, which has the longest survival. When it comes to material, there are 3 different types of material used in joint replacement surgery. One, the gold standard cobalt chrome. Number 2 is the oxinium, and number 3 is the niobium, which is the newer material. All the registries have shown fantastic results with the cobalt chromium implants, and it is still considered the gold standard. I certainly use cobalt chrome implants in majority of the patients. When you think about the outcome of a knee surgery or a knee replacement surgery, there are 3 most important factors. 1, surgeon factors. 2, patient factors. 3, implant factors. Surgeon factors are particularly the experience of the surgeon, how commonly the surgeon does the procedure, how well the surgeon can perform the implantation, and what kind of surgical technique the surgeon uses. When it comes to the technique, again, there are different types of techniques, like a manual surgery where we eyeball on landmarks based on which we do the cuts on the bone and then fix the implants into the bone using computers called computer navigation, which gives alignment of the knee better. By saying alignment of the knee, it is when you draw a line from center of the hip joint, center of the knee and center of the ankle, all lying in the same line. Because studies have shown that if this alignment is beyond 3 degrees, the possibility of early failure is high. Certainly using computer navigation has improved the accuracy of alignment in comparison with manual technique. The other technique which is coming into vogue is using robots. But when you actually look at what the robot does is similar to the computer navigation, except for making the bone cuts. Still, there is a lot of improvement needed in robotic surgery. There are a lot of techniques which have come and have not been used, like patient-specific knee replacements, where we do MRI of the knee joint, based on which we do a virtual surgery on the computer, and guides are made or created which are used at the time of surgery. Certainly it improves the accuracy. However, the cost of the joint replacement is also increased. That is one of the reasons why it has gone out of favor, particularly in India. Robotic surgery is becoming famous. However, we are not sure about how it is going to impact on the long-term outcome. So far, there is not much difference when we do knee replacement with a computerized navigation or robotic surgery. The other impacting factors which the patient has to consider is the patient's own condition. Weight is the predominant factor which can impact on the longevity of the implant. Patients who are over 35 BMI, the joint replacement can fail early on. Hence, I always suggest the patients to consider loss of weight either by following proper diet or going ahead with a bariatric procedure. The other factors which can impact patients' outcomes are if there are any inflammatory conditions, the risk of infection, etc. Majority of the surgeons perform knee replacement using manual techniques. I personally use computer navigation in all of my cases. Post-surgery, the patient can walk on day 1 with support, and gradually, with the help of physiotherapists, their walking ability will improve. The recovery time is usually around 6 weeks from surgery, and majority of the patients can walk independently from 4 weeks onwards. They need to do rehabilitation to improve the range of movement of the joint and also strengthen the muscles, which help in improving the function of the joint as well as their mobility. The other common questions patients do ask is, what kind of activities can I do? Post knee replacement, patients can walk as long as they would like. They would be able to do stairs within 2 weeks from surgery. Sitting down on the floor is still not recommended because the amount of bend you need in the knee is significant. However, once you achieve that movement, you should be able to sit on the floor for short periods. Running I usually discourage because the paucity of literature on how it impacts on the survival of the knee replacement. Knee replacement surgery is very safe. It has significant impact on patients' quality of life. It is a very cost-effective procedure when choosing the right implants and the right surgeon. I'm more than happy to get in touch with you. If you have any questions, you can reach me on my email drthati@hotmail.com for any further questions you have. Thank you very much.
Download Qural app now and be smart about your healthcare.